Hi, I'm Kim McCarl. I'm Communications Officer for Contra Costa Health Services. We're here today with our third public report out for the Community Crisis Response Collaboration. Thank you for joining us. As you watch today's video, I think you'll see how excited the team is as we move closer to determining how best to meet our identified overall goal, or what we call the aim in this process. The goal is for anyone in Contra Costa County to be able to access behavioral health services anywhere, anytime. Behavioral health crisis response is a concern around the world. You may remember from our last report out that we had some contact with an organization in England who was doing similar work, and we learned a lot from that experience. And we're really aware, I think, of how much these services really matter and how incredibly important it is to get everyone the help they need in crisis. And so I think you'll see today that the team is moving closer to how we might go about meeting our aim, and is very excited about that. So the team spent this past week really testing real workflows, which you'll hear about, to get a sense of how tools will actually work in the real world, and what will work and what won't work. The video that we're going to show you is about 30 minutes long. It'll share what they learned, and again, hopefully you'll see how excited they are about the work that's been happening. So again, about 30 minutes. We'll see you on the other side, so let's watch.
Welcome and good afternoon, everyone. My name is Dennis Sees. I'm an improvement advisor, and we have some very exciting news to share with you this afternoon. And thank you for coming out, and I will talk to you shortly after I turn it over to my esteemed colleague, Marty.
My name is Marty Beggs-Casson. I'm a police manager at Walnut Creek Police Department. I'm going to be talking about our AIM statement. And it is anyone in Contra Costa County can access timely and appropriate behavioral health crisis services anywhere and anytime. And this AIM statement was developed by all of us as a team, and this is also a multi-year goal.
Hi, my name is Aisha Banks. I'm an improvement advisor. This week, the focus of Rapid Improvement 3 was testing the model. In front of you, you're looking at 4 priority improvement areas that has been the focus of our community crisis model. One being the Community Crisis Hub, which will provide 24-hour response that will include different team configurations of non-police teams, and also providing alternate destinations outside of PES and jail.
During this event, we had the opportunity to hear a very valid lived experience. This came from Miles Hall's mother, Ton Hall. I would like to quote her. "The way the system is set up, it's just failing. The criminalization, not having enough resources to make sure he was kept safe. Just so many things had failed us."
Hi, I'm Jan Kobolita-Kegler, and I'm the Program Chief for Adult and Older Adult Behavioral Health Services. I have the honor of presenting to you today the fruits of our labor of the week, a Contra Costa Community Crisis Response Model, serving anyone, anytime, any place. You know, many of us are familiar with when we have a crisis, the old model was, we'll just call 911 and they'll send an ambulance. But over the last couple of years, we've been looking at trying to develop alternatives to 911 response. And especially when someone's having a mental health crisis, there's other ways that we can approach a crisis. And we've been working in our Community Crisis Response Initiative to develop alternatives to police response and develop non-police response to those crises. And that's what you see in front of you, our Community Crisis Response Model. You know, we're all familiar with the phrase, it takes a village to raise a child. And we in health services understand this sentiment most deeply. And this week, as I participated as a member of the Community Crisis Response Team Initiative, I became intensely aware that yes, it takes a village to raise a child, and it also takes many villages to build and harbor safe communities. And it is our hope that our Community Crisis Response Model will help to build and harbor safe communities. and prevent human tragedies from happening. So what is the community crisis response model? Well, it is an attempt to provide support to people who are suffering or struggling with mental health crises. They call for help. Over here on the left, you see the emblem, a call for help. And these calls, people call for help from individual people, third party, 211, access line. And these calls come in, and I'm going to bring your attention to, in the middle of the chart, the Miles Hall Community Crisis Hub. So we've been working intensely to develop a crisis response hub, a place that takes calls from people calling from all places, listens, there's somebody there to listen, support, and decide how we're going to respond with the appropriate level of response. Are we going to send a team out to you, or are we going to talk to you and offer connections to other resources in the community? And that is where you see, if you go down the line, we go the pink level, the blue level, the gray level, someone to help. What kinds of appropriate services would you need? And then somewhere to go. Sometimes when people are having a mental health crisis, they need the hospital, they might need to go to a crisis center, a shelter, a sobering center, or other destinations. We want to be able to offer a menu of whatever, a continuum of services to address whatever crisis is coming up. The Miles Hall Community Crisis Hub is named after a young man, Miles Hall. He died tragically 2 years ago. He was an African-American young man dealing with mental health issues, and he was tragically killed by police 2 years ago. June 2nd is the anniversary of his death. And we are honored to name the Community Crisis Hub after Miles, to acknowledge that many times crises can be handled in so many different ways, and to also create a legacy of hope for people in the future, that we prevent tragedies like this from happening. Then over here, there's one more thing I want to point out is there are times where 911 is an important and necessary option. And we have that option to contact 911 and send out paramedics and police to respond if that's what needs to happen.
Hi, my name is Chad Pierce with Contra Costa Health Services, West County Children's Mental Health. This has been a very exciting week for us. And the slide here that you see shows a photo of our simulated Miles Hall Community Crisis Hub. We had the opportunity to put our previously designed workflow into action by testing software that allowed us to answer multiple calls, triage those calls, and dispatch our regional mobile response teams. The hub serves as our air traffic control center, and we see it as a very welcoming place where we coordinate crisis care for anyone, anywhere, and anytime.
My name is Gerald Lerniker with Children's Mental Health, Contra Costa County. We tested 3 new software systems: In Contact for fielding calls and connecting callers to mobile response teams, the Workforce Geographic Information System to track and dispatch mobile teams, and Survey 123 to complete triage forms, share those with field-based teams in real time, and enable teams to communicate back to the hub.
Hi, my name is Erin Riley. I'm a dispatch supervisor with the Office of the Sheriff. The example before you is a dashboard for the ArcGIS workforce application that the call takers were using in the call center. This shows the assignments assigned to the teams, crisis teams that were dispatched. It also shows along the right-hand side the notes that they are able to make via their tablets when they're on calls. It also shows along the top how many calls that are pending and or being handled. The number 4 also shows the number of units that are on duty.
Hi, my name is Lisa DeMose. I'm an epidemiologist at Contra Costa Health Services. This is the Mobile Crisis Response Team Manager tool. It allowed us to see the survey intake information along with assignments made geographically in near real time.
Hi, this is Jennifer Tuipilotu, and I am from the Office for Consumer Empowerment in Behavioral Health Administration for Contra Costa Health Services. Now you are looking at our information where we have processed 46 calls at our stations, and 6 call takers were staggered throughout the day. We had an average of 4 people, and the calls were dispatched to the appropriate field teams compositions. And what else was important was at the end of the calls, we also asked the callers for their input and their perspective of what it was like on their end. And here are a couple of comments and suggestions. So starting with a couple of questions were repeated and could cause frustration during a crisis. So that's something for us to think about moving forward. Also, I think that the crisis call might be better with suggesting a tip on how to reduce anxiety in the moment, as well as having help come as soon as possible. And finally, I also like the fact that I was given the option to talk in person with a crisis staff person or to continue on the phone. Now, these again are comments and suggestions that came from people that called in that have lived experience. And so we know that it is imperative that we get this right moving forward to truly support our aim, which is for our community, anywhere, anyone, at any time.
Hi, my name is Melaine Venenciano. I'm a senior administrative analyst with the City of Pittsburgh. And as we continue this work, we would like to share several lessons learned in the process. Staffing the virtual hub with appropriate personnel is key. We noted that the number of trained call takers needs to be flexible to account for the variability in call volumes. Hub staff need to master the software that will be used, since it was very challenging coordinating 3 systems while trying to be present with the caller. We found that having the appropriate technology to support the work is essential to hub operations. Having multiple screens provides a high-level view of the calls and where the field teams are, so we know who can be assigned to the call. Having the necessary equipment and high-speed internet will allow for timely interaction among all parties. We have a quote from a caller with lived experience. Less hold time would be great. We understand that being on hold during a crisis is unacceptable. Therefore, the goal of having the hub properly structured and staffed is vital.
My name is Kenesha Johnson, Program Chief of Housing Services with Behavioral Health. And leading up to this event, we've been talking about a virtual hub. But this week, we were able to test the live Miles Hall Community Crisis Hub. And based on our lessons learned this week, we've been able to prepare a list of what we believe is needed in preparation for launch of this project. We would need office space to be able to set up workstations like you see in the picture below, where we can set up multiple screens to be able to accurately use the software that we're testing. We'd also need technology to continue to test the appropriate softwares and continue community collaboration with community members, community organizations, and law enforcement that have been able to richly help us develop this model. And we would need staffing. As you heard, having the correct amount of staffing is vitally important. And some of the caller feedback that we received is, I really look forward to having a more streamlined process to better help in crisis, as well as the consistency. And I'm looking forward to what process is going to result in for our crisis response systems.
Hello, my name is Barbara Serwin, and I'm a member of the Mental Health Commission and the Triage team. The charge of the Triage team is to help call takers quickly identify which field team should respond to a crisis call. But first, a family perspective. This woman's husband had bipolar, and he was a binge drinker. He was untreated and self-medicating. He was exhibiting menacing behavior to her and her adult son, and this was over an extended period of time and finally reached a crisis level. So she called the crisis service to come out, and this is what she had to say. Send in the right people with the training and experience to know who they are dealing with. My husband, who is bipolar, charmed social services and a psychiatrist into thinking that I had the problem, not him. Here's what the triage team did. We developed a triage protocol tool, and the purpose of the tool is to give direction to the call taker on what intervention to choose. It's also to standardize triage to ensure consistency of outcomes regardless of the call taker. And the goals of the tool are to be comprehensive, accurate, to balance standardization and flexibility, and to be easy to use. Now here's a snapshot of the triage protocol. There are 5 crisis levels, and you can see a few of them here. The gray band across the top of each box indicates the crisis level, ranging from at the most acute level, the emergent crisis with imminent danger, ranging down to the least crisis level, a routine outpatient call. The small text in the box indicate the symptoms and behavior that the caller is describing to the call taker, and they are what drive the intervention, which you can see on the right-hand side, the vertical tabs, 911 or a collaborative response team, or the other triage teams that are in the field, and also a referral to the access line to make an outpatient appointment. The response team configuration is determined by the nature of the crisis. And there are 4 major interventions, 3 different response teams, and the outpatient appointment.
Hi, my name is Steve Honsmith. I'm Behavioral Health Informatics Chief. Just a little more on the triage tool that we developed and the goal that we have for the information that's collected on the tool and the call itself. So again, we designed the call data entry template. It's gone from a Word document on paper to software application. The purpose was to enable the call information to be entered into the virtual hub system for everybody to see. And the goal was to capture information, the right information from the caller so that we can make good decisions about how to handle the call. So again, we want to capture information from the beginning of the call all the way to the response itself. This is a view of kind of how the software application looks to the at the call center. So on it, there are 20 background questions. There's 5 crisis levels that's sort of determined by the tool itself. And there's 5 different kinds of response types that we've configured so far. We're still working on team configuration. So this is kind of a mock-up of what we've been using in the testing so far. So we have learned some things as we've gone through some testing with the protocol. It would be helpful if it were more decisive, more determinative, and at the same time adding some flexibility for judgment calls. And then also that we do need to improve the triage tool so that it has a children-specific areas as well. Preparing for the launch. So before the launch, we would like to do some more refinement, more testing of the triage tool, looking for the accuracy, the comprehensiveness, ease of use, decisiveness, flexibility. Again, we want to enhance the tool so that it has space for children's triaging. And we want to extend the data entry template so that it's in-depth and comprehensive. And we really want to have it so that we have information available to the call center as well as the teams going out on the call so that everybody's kind of on the same page and we're adding information, we're not repeating information.
Hi, my name is Denton Carlson. I'm a captain with the San Ramon Police Department and a member of the Collaborative Response Team. This week provided an outstanding forum for our group to try numerous aspects of our collaborative approach with a focus on best serving our community clients who require care due to a mental health related incident. We've tested several elements this week, which led to some exciting lessons learned and positive recommendations for the future launch of this program.
Hi, my name is Joe Bruno. I am here to share a lived experience story of my crises. I had landed in two 5150 cases where I wasn't getting many resources. I wasn't getting much help in my crises. So in that process, I got caught up in a systematic algorithm where Community Connects had reached out to me to see if I needed any extra help. And even to this day, that was almost 2 years ago when I got that connection from Community Connects, that I'm still getting phone calls and outreach and to make sure that everything's going okay. So the algorithm of Community Connects was very helpful in collecting more resources for me in that moment.
Hello, I'm Natalie Demijan, Program Supervisor with the Mobile Crisis Response Team. During this week's Rapid Improvement event, the Miles Hall Community Crisis Hub used this crisis intervention triage tool to determine the ideal team to dispatch to the location of the crisis. Listed here are the team compositions. Crisis Level 1, Peer Support Worker, EMT. Crisis Level 2, Clinician, Peer Support Worker, plus minus EMT. Crisis Level 3, Law Enforcement, Clinician, Peer Support Worker, plus minus EMT. As we tested the different team configurations requested by the Miles Hall Community Crisis Hub, we also tracked whether the ideal team was dispatched to the crisis location. We will continue to track this data as we prepare for the pilot. Thank you.
Hello, my name is Bradley Lindblom, and I'm a lieutenant with the San Pablo Police Department and had the honor of being a part of the collaborative response team. So what we wanted to test this week was a regionalized approach for the mobile response teams throughout the county. Specifically, we placed a team in West, East, and Central counties. This was to see the difference in response times to crisis calls to ensure our community gets timely behavioral health services. What we noticed at the conclusion of our testing was what we suspected, that with regionalizing our teams, our response time was cut down from what we are traditionally seeing with a centralized approach. Moving forward, we will be simulating different crises at different times of the week and different days of the week to ensure the staffing of the team is sufficient for quality response times to anyone, anywhere when developing our model. This next slide demonstrates the simulated events throughout the county where we gather data on response times from our regionalized teams using the simulated mobile crisis operational dashboard.
Hello, my name is Amanda Dole, licensed clinician and program manager with behavioral health. We learned many great things this week that will help us to prepare for our pilot. It was wonderful to collaborate among all of our teams, both in person and virtually, to put our ideas from past events into action. This week, we learned the importance of cross-training all response team staff so that they can be equipped to work with both youth and adults. While we made progress in testing our various team compositions this week, we know that more refinement is needed so that we can identify the best teams for our community. In order to improve workflows and response time, the field teams need enhanced communication back to the hub. We were thinking that this could include a separate phone number for field teams to communicate directly with the hub staff if they have a question about the field response they're about to respond to. In addition to ways that we want to improve, we also learned about many things this week that worked really well. In our simulated calls, the warm handoffs worked well between the hub and the field team because the hub effectively and quickly described the caller's concerns before turning the call over to the field team to respond.
Hi, I'm Tamara Diaz, again from Contra Costa Youth Continuum of Services. A collaborative response team, we prepared for launch. We're preparing for launch on July 2021 pilot. We're going to develop a pilot team, phones and effective technology platforms, and access to important client information, medical history, previous services, care team members, etc. And finally, regional vehicles for team to transport people.
Hi, I'm Marty from the Walnut Creek Police Department again. I was honored to be part of the alternate destinations team, and we were tasked with finding a place for people to go and what was needed for them in regards to services in our county. It was a very interesting challenge, and I think our team met it. One of our new team members was Joe Bruno, who you've heard from before, and she had a lived experience perspective that really hit toward the heart of what we were trying to do in the alternate destinations team. She was frustrated because she had been stuck in the system. And what she told us was, I need to stop being stuck in the system, and we need to stop talking about being stuck in the system. It needs to come down to the people and their needs because the system is broken. This discussion is very systematic focused, and it needs to bring humanity back into the conversation.
Hi, my name is Debbie Thomas. I am a licensed clinician with Contra Costa County Behavioral Health Services Forensic Mental Health. I had the pleasure of being on the alternate destinations team, and we were charged with solving the problem that psychiatric emergency services is the only 24/7 facility in Contra Costa County for people experiencing a behavioral health crisis. Our goal is to provide safe, alternative facilities and services for people experiencing a behavioral health crisis.
I'm Melissa Nino from Contra Costa Health Services, Health Information Management Department. And this is what our team learned. We analyzed data from the Psychiatric Emergency Services and the Mobile Crisis Response Team. In doing this, we identified facilities that would be the appropriate destination aside from psychiatric emergency services. We also learned that we can substantially reduce psychiatric emergency service visits. And we strongly recommend a dedicated rapid improvement event for a deeper dive to explore alternative destinations.
Hello again, everybody. It's Joe Bruno. I'm going to talk a little bit about peer respites here. And a peer respite is a voluntary short-term residential program staffed and operated by peers with lived experience who are supporting people living that experience. It's a place where peers can meet with other peers. It's a place of community with a comfort of home and safety. The mobile crisis response team data came up with that 42% of people would benefit from an alternative destination like a peer respite in our county. And second story in the peer respite in Santa Cruz showed that a study in 2015 that their guests of their peer respite, they were 70% less likely to use inpatient or emergency services. So ultimately, peer respites are needed because folks need a place to rest before it becomes a crisis.
Hi, I'm John Gallagher, a case manager at Hope Solutions. What is a facility that provides crisis intervention services? It's a facility that's appropriately staffed and available to people in need 24/7. It's a facility that provides short-term care, typically less than 24 hours, to include crisis intervention and stabilization, medical evaluation, and peer support, and referrals and linkage to additional support. So what's the data? In reviewing more than 2 years worth of data from visits of our county's residents to psychiatric emergency services, we found that 25% of the people were released within 24 hours and could have benefited from the availability of an alternate facility providing these types of crisis intervention services.
Hi, my name is Hillary Bowers. I am the Core Homeless Outreach Coordinator. And one of the alternative destinations that we determined we have a need for in Contra Costa County is a sobering center. So what is a sobering center? A sobering center is a facility that provides short-term, 23-hour recovery, detoxification, and recuperation from the effects of alcohol or drug intoxication. Sobering centers are fully staffed facilities that help to provide oversight and ongoing monitoring through the sobering process. They include alternatives to jail and emergency departments, as well as drop-in centers. Some of the data we analyzed from psychiatric emergency services showed us that 5% of the visits involving alcohol intoxication could have been diverted to a place such as a sobering center.
Hi, my name is Aisha Banks, Improvement Advisor. I will be introducing the data measures section. As you've heard all along throughout our presentation, we've included our community members and their stories, and this was intentional. That is because we believe no data without stories, no stories without data. Jay, who is a community member, shared his crisis story with us, and also he shared the importance of a community organization being able to help him through his crisis. And as you see on the screen, the Rainbow Community Center gave him hope. By being able to incorporate stories like Jay, we're able to build a community crisis model that with metrics that will definitely matter the most to our community members.
Matt White with Contra Costa Health Services, Office of Informatics and Technology. And thank you, Aisha, for that introduction and bringing the human element to data. I just wanted to share that this approach to data in the work is a journey. And we've started by really focusing on kind of the what to measure and why, and defining those measures. And then during these last 3 days, as part of the Rapid Improvement event, we've really started to take our first look at who and where do we want to capture the data, how to calculate these measures and track them over time so that we can really ultimately learn and improve and deliver on those outcomes. Thank you.
Great, everybody. Now, so where do we go from here? Again, I'm Dennis Dees. I'm an improvement advisor on the team here. So these are the things that we would like to do. Develop a detailed testing and launch plan that will include facilities, staffing, equipment, technology, and vehicles. Identify existing resources to leverage for this test and launch plan. Test and launch the pilot by July 15th, a little over a month from now. And actually what we would like to do too is develop agreements for pilot sites county-wide, which includes, say, the West, the East, Central, and South regions.
Hi, my name is Tamara Diaz, and I'm a case manager for Contra Costa Youth Continuum of Services. One of our lived experiences volunteers stated, "Don't be afraid to say you need help. Always put yourself first, especially with mental health." This was Angelica Brownlee.
Reflecting on this particular journey, it's been a total team effort, and I really would like to just thank everybody for your continued support and participation as we move toward our Miles Hall Crisis Community Center. Especially, I would like to thank all of our sponsors, our Contra Costa Regional Health Foundation, all the speakers that we had this particular week, Town Hall, Jay Razzle, Angelica, Joe, our process owners, our leadership advisory group, and our Public Managers Association, and especially our city managers for actually helping us partake on this great endeavor. I would like to thank all our sponsors, funders, and city leaders, especially Contra Costa Regional Health Foundation, our funders, Contra Costa Health Services, especially Anna Roth and Erica Jensen for their outstanding and great leadership. I'd also like to extend a sincere thanks to our city managers on the PMA group from Walnut Creek, Lafayette, San Ramon, San Pablo, Pittsburgh, Antioch, and Concord. Again, our sincere thanks for all your support and leadership in this great effort. Thank you. And now I'll turn it over to Serena, and she will actually thank the team.
My name is Maria Zarina Nicole Santaelena, student intern. I would just like to give such a huge thanks to the team for all your hard work, your time, and your efforts. It has been such a fantastic and productive week with you all, and it's honestly so exciting to see everything come together. And soon enough, we'll be able to launch this new system and make a positive change within our communities. Thank you.
Well, I'll add my thanks to this team. I'm always so impressed at the partnerships and collaboration that come from across the county that it takes to put these rapid response events together. And certainly this time is no different. So thank you all. A quick reminder that today's video and the PowerPoint will be available on our website at cchealth.org after today's presentation, so you can use the information and study it at your leisure. It's a lot of information to present at one time, and so we want to make sure that that resource is available to the community. So without any further delay, I'd like to invite Anna Roth, who's the Director for Contra Costa Health Services, to share some of her thoughts today.
Thank you all. One of my inspirations, Father Gregory Boyle says, when you fill my heart, my eyes overflow. So I'm grateful that there was a little break there for Kim, so I could recompose myself, because I'm so moved by the work that you have all done. Father Boyle also says that assume that the answer to every question is compassion. And I just want to start by thanking the team for taking on this work from a place of love and compassion, from a place of rigor and discipline, from a place of tenacity and never giving up. It was such a treat for the times that I was able to jump in and listen in and join you as a observer. It was such a treat that we're now at a place where we even had to have a little bit of time in person. So I want to thank you for that, and I'm going to come back to that. I also want to thank the sponsors, the co-sponsors that were listed out by Dennis from the various cities. And I know that the sponsors, as well as myself, we represent a vast array of leadership across the county and the different jurisdictions who are all who have all lifted this as a priority in our region, within our different sectors. And so though there's a group of sponsors listed, I want to express gratitude, because we represent, and we were nominated by a much larger group of leadership across the community to really shepherd some of this work. And I want to thank our community members with lived experience, both those who are experiencing mental health issues and those who love them and have really shown up and informed the team, informed the leadership, and continued to highlight the struggle within our community of getting help when you need it. The team really took those stories to heart, and I believe that partnership of working shoulder to shoulder with those with lived experience made all of the difference in this design process. I want to just highlight a couple of highlights, because there's so much in the report out. The model that really talked about the someone to call, someone to talk to, someone to respond, and a place to go really does take, I think, a lot of the work that's already going on and reorganizes it in a way that reflects hope and recovery. I want to thank you for building the front door to the system. I think a door, that door being the Miles Hall Crisis Response Hub, and it's a door that doesn't require a key. So I know that when we came in with a lot of, I think, assumptions, but I think, again, answering a lot of questions, right? Answering those questions with compassion really resulted in the Miles Hall Crisis Response Hub. And I want to just congratulate you for really putting some stakes in the ground and starting to test. When I saw the software, I was able to see some of these tests going on, and the level of testing that went on this week is unmatched in terms of the level of testing that we've done in a variety of the rapid improvement events that we've had. So I feel really grateful for that work, and I want to thank all the agencies that brought the kind of expertise that we needed. You heard dispatch centers showed up. We had epidemiology there. There was all kinds of technology that for health we aren't familiar with, and so it was I think a very rich experience, and we learned a lot. And I think now we really have a much deeper understanding of the different assets and infrastructure within our system that are there to really support those in need. When we look ahead, and I just want to I want to keep my comments short because I just want to express gratitude to this team and to our community for taking this journey. And I want to say I heard from Dennis and from the team that as we look ahead, there's a lot of work to do. I heard we're launching our pilot in mid-July, and that pilot really is going to be centered on the Miles Hall Crisis Response Hub. And we know that there's a great deal of work ahead. I heard the team call for a deep dive rapid improvement event around alternate destinations. So though I know this feels somewhat of a capstone, I think this is a capstone of phase one, and we have a lot of work to do ahead. And I'm already enlisting or counting on all of us to stay together. We know that that this is the beginning, and I do think this is something different. I'll close with, again, one of my favorite poets, 13th century poet Rumi, who reminds us that our heart knows the way and that we should run in that direction. So thank you so much, and let's run together.
Thank you, Anna. Those are really heartfelt words, and I appreciate you sharing those with us. I'd like to, as we normally do, ask all the team to turn their videos on if you're comfortable coming on screen. I think it's really important always to share the screen with all of you who did this important work. So we'll just take a minute and watch you all come on screen. This is always my favorite part. So I've thanked the team before for allowing me to be a part of this, and I thank you again. But really, all the hard work was done by the faces that you see on the screen today. So thank you all very much. I just want to remind everybody that the video and the PowerPoint will be available on our website at cchealth.org. We will also have a schedule of times that this video will run on CCTV on that website in the coming days. And it will also be available on YouTube. So again, take the time you need to watch it and digest the information. It was a lot, it was important, and definitely worth the time. So thank you for joining us, and enjoy the rest of your day.